Hello. Hello, everyone. Good afternoon. Yeah, my name is Dr. Mbaraka Wesse Lusato from Kira Road Police Regional Hospital. Today, I would like to share about the relationship between psychiatric care and the mental disability. In my presentations today, I have a learning objective. We're gonna see the introduction of the relationship between psychiatric care and the mental disability, the role of psychiatric care in addressing mental disability. This is a holistic approach. And the third one, the medication management and the psychiatric treatment. The fourth one, the challenge in providing effective psychiatric care for individuals with mental disability. And the fifth one, to promote the access and equity in psychiatric care for people with mental disabilities. Sixth one, integrating support services. This is the collaborative efforts between psychiatric care and the social services. And the seventh is to enhance the quality of life. And the last, we're gonna see the future directions of the psychiatric care and the mental disability. By starting with the introduction, we're gonna understand the interconnection between psychiatric care and the mental disabilities. In today's society, the vital relationship between psychiatric care and mental disability cannot be understated. Mental disabilities encompass a diverse range of conditions, from neurodevelopmental disorder to mood and anxiety disorders, all of which significantly impact an individual's cognitive, emotion, and behavioral functioning. Psychiatric care plays a crucial role in addressing and managing these disabilities, offering a holistic approach that combines diagnosis, treatment, and support services. However, there are numerous challenges to provide effective care, including stigma, limited resource, and accessibility barriers. Introduction. This presentation dives into the complex of the relationship between psychiatric care and the mental disabilities, exploring the role of psychiatric care, addressing the challenge, promoting access and equity, and discussing future direction to improve the quality of care for individuals with mental disabilities. Psychiatric care plays a vital role in supporting individuals with mental disabilities and promoting their overall well-being. Mental disability refers to a broad spectrum of mental health conditions that significantly impact a person's thought, emotion, and behavior. In this presentation, we will explore the interconnection between psychiatric care and mental disabilities and how these two elements work together to provide a holistic support to individuals in need. Mental disability encompasses various conditions that affect a person's mental health and functioning. Let's dive into some of the major categories. All we know that mental disabilities, it encompasses with a neurodevelopmental disorder. By definition, neurodevelopmental disorder, it includes conditions such as autism spectrum disorder, attention deficit hyperactivity disorder, ADHD. These conditions often manifest in early childhood and can impact social interaction, communication, and the behavior of the individual persons. The second one is mood disorder. Mood disorders such as depression and bipolar are characterized by persistent change in mood, energy levels, and overall emotion well-being. They can significantly affect a person's ability to function and enjoy life. Anxiety disorder is another category of mental disabilities. It involves excessive and uncontrollable worry, fear, and anxiety. Conditions like generalized anxiety disorder, panic disorder, and post-traumatic stress disorder, PTSD, can disrupt daily life and cause significant distress. Psychiatric disorder such as schizophrenia, involve a loss of touch with reality, including hallucination, delusion. These conditions require specialized care and support to manage symptoms and improve quality of life. Psychiatric care takes a holistic approach to address a mental disability. Let's explore some essential components of this approach. First, in psychiatric care, diagnosis and assessment in psychiatric care. These accurate diagnosis and assessment are crucial in determining the appropriate treatment and support for individuals with mental disabilities. Psychiatric professionals utilize various assessment tools and techniques to understand a person's symptoms, history, and a specific need. Medication management and psychiatric treatment. Medication management plays a vital role in treating mental disabilities, especially for conditions like mood disorder and psychotic disorder. Psychiatrists work close with individuals to find the right medication and monitor their effectiveness, ensuring optimal symptoms management. Psychotherapy and counseling for mental disabilities. Psychotherapy and counseling provide individuals with mental disabilities a safe space to explore their thought, emotion, and behavior. Therapists use various techniques such as cognitive behavioral therapy or talk therapy to help individuals develop coping strategies, improve their mental well-being, and promote personal growth. So, in managing psychiatric disorder or mental disabilities, there is some challenge we face. While psychiatric care is essential, it faces numerous challenges in effective supporting individuals with mental disabilities. Let's examine some of these challenges we face during our management for mental disability patients. Number one is the stigma and discrimination in mental health services. Stigma and discriminations surrounding mental health can create barriers to access quality psychiatric care. Many individuals with mental disabilities face judgment, misunderstanding, and a lack of empathy, which can hinder their willingness to seek help and receive appropriate treatment. Number two is about accessibility barriers for individuals with mental disabilities. In our community, this is the big challenge for the person with mental disabilities in order to access the services. Individuals with mental disabilities, particularly those with physical limitations or living in remote areas, limited transportation options, financial constraints, and the lack of specialized service can make it difficult for individuals to access the psychiatric care they need. Also, there is limited resources and funding for psychiatric care. As we know, psychiatric care is not prioritized in so many different countries. So this also, it's also a challenge to professionals to deal with these challenges. Mental health often struggle with limited resource and funding. This shortage can result in lack of mental health professionals, long waiting times for appointment, and reduce availability of specialized treatment options. Adequate funding and resources allocation are crucial to ensure that everyone has access to quality psychiatric care. Note also, by understanding the interconnection between psychiatric care and the mental disability, we can work towards improving the support and the services available to individuals in need. Through continuing advocacy, destigmatizations, and increased investment, we can create a society that prioritizes mental health and provide effective care for all. So, by promoting access and equity in psychiatric care for people with mental disabilities, community-based mental health program, when it comes to provide psychiatric care for individuals with mental disabilities, community-based program play a crucial role. This program bring care direct to the communities, making it more accessible for those who may face transportation or other barriers by offering mental health services in their familiar and comfortable settings, such as community centers or local clinic. Individuals with mental disabilities can receive the care they need without additional stress or inconvenience. Another one, by promoting the access, we're gonna look about cultural sensitive approach to psychiatric care. Psychiatric care should not be a one-size-fits-all approach. Cultural sensitivity is vital in ensuring that individuals with mental disabilities receive care that respect their unique backgrounds and beliefs. By understanding and incorporating cultural consideration into treatment plan, psychiatric care providers can establish trust and work collaborative with the patient. This approach promotes better engagement, understanding, and ultimately more effective care. Advocacy and policy initiating for mental health equality. Advocacy and policy initiative are essential for promoting mental health equality. By advocating for policies that address the need of individuals with mental disability, we can ensure that psychiatric care is accessible, affordable, and comprehensive. This includes fighting for insurance coverage for mental health services, increase funding for the community mental health programs, and promoting parity between mental health and physical health care. Another one is about case management and the coordinations of care. In providing case management services are crucial for individuals with mental disabilities by ensuring that psychiatric care is integrated with other support services such as housing assistance, employment support, and a social program. Individuals can have more holistic approach to their well-being. Case managers act as advocates and guides, assisting individuals in navigating the complex web of services and the resources available to them. Housing and employment support for individuals with mental disabilities. Security, stable housing, and meaningful employment is essential for individuals with mental disabilities to thrive. Psychiatric care providers can work collaboratively with housing agencies and vocational rehabilitation services to help individuals access suitable housing options and develop skills for employment. By addressing these practical needs alongside mental health treatment, individuals can achieve greater independence and overall well-being. Peer support and community integration programs. Support from peers who have personal experience with mental disabilities can be incredibly beneficial. Peer support programs provide individuals with a sense of belonging and understanding, reducing feelings of isolation and stigma. This program offers a space for individuals to share experience, learn coping strategies, and establish a support network. Additional community integrations programs encourage individuals with mental disabilities to actively participate in their communities, promoting inclusion and reducing social isolation. So another subsection is enhancing the quality of life. Success story in psychiatric care for individuals with mental disabilities. Personal story of recovery and the resilience. Personal story and the recovery and the resilience showcase the transformative power of psychiatric care for individuals with mental disabilities. These stories inspire hope and demonstrate that with the right support and the treatment, individuals can overcome challenges, and lead fulfilling lives. Sharing this success story is not only uplifting, but also help reduce the stigma surrounding mental health issues. Innovative approach in psychiatric care. Innovation in psychiatric care continue to push the boundaries of what is possible, from the use of technology to deliver therapy and monitor progress remotely to the integration of alternative therapies like art or animal-assisted investigations. Innovation approach offer new avenues for supporting individuals with mental disabilities. This approach brings creativity and flexibility to psychiatric care, tailoring treatment to individual needs and preferences. Yeah. On this, another subsections of future directions, innovations, and the strategies for improved psychiatric care for people with mental disabilities. Number one is advanced technology. Technology holds immense potential for improving psychiatric care for individuals with mental disabilities. Telepsychiatrics, for example, allow individuals to receive care remotely, eliminating geographical barriers and increase access to specialized provider. Mobile application and the digital platforms can also be used to deliver self-help interventions, provide real-time monitoring, and offer support between therapy sessions. Embracing technology advancement ensures that psychiatric care remain at the forefront of innovations, ultimately enhancing overall outcomes and improving the lives of those with mental disabilities. In conclusion, the interconnection between psychiatric care and the mental disabilities is essential for promoting the well-being and the quality of life of individuals experiencing mental disabilities. By recognizing and addressing the diverse range of mental health conditions, integrating support services, and promoting access and equity in psychiatric care, we can strive toward a more inclusive and a compassionate society. While challenges persist, there is hope in the success story and the innovative approach that have emerged, offering glimpses of a brighter future. By continuing to prioritize and invest in improved psychiatric care, we can create a society that supports the unique needs and the aspirations of individuals with mental disabilities, fostering their recovery, resilience, and overall health. Thank you for listening.